Magee, surprisingly, a lot of people think it's just like a women's hospital and that's all we do. But we do literally everything from A to Z. You name it, we most likely do it.
Many Magee parents often talk about how much the nurses and providers leave an everlasting impact on their lives. But I don't think they realize just how much they leave an impact on us as well. I always do my very best for my patients, but it is a heavy load to carry when you leave work feeling like you could have done more.
A hospital like Magee, the reputation of UPMC, the history of Pittsburgh and our innovations and advancements in medicine, we should be excellent also. That's what we're striving for. We want excellence as nurses.
The staffing proposals we are presenting today reflect these priorities.
So as ICU nurses, we often have to make very difficult choices and decisions. For instance, I may have to pick which patient I see first given the acuity of that patient. There is the National Acute Care Guidelines. ICU patients should be 2-to-1. That is not often seen when the census is higher or we're getting patients for other hospitals. We can't necessarily follow that to a T, though that is evidence-based practice, which is what we should use in a hospital. That is what we use to care for our patients. That is what doctors use to come up with different treatment plans. It is medicine.
They're proposing for a unit like ours with telemetry and advanced surgeries to be 1-to-4. That would allow us time to give emotional support, to observe the patient so we catch things before they become a problem and we're sending them to the ICU. Almost everybody is dealing with the fact that they have cancer. They're not sure how long they will live. They're not sure, whether what we're doing for them as far as surgery is going to cure their cancer, or are they going to be worried about this the rest of their lives? And most of them are going to be worried because there's no guarantees.
I can tell you from experience that healthcare providers are desperate to spend more time with our patients. We want to read your chart thoroughly before we meet you. Although each department of nurse practitioners and midwives has slightly varied needs, across the board, our advanced practice providers are proposing changes that will allow us to spend more time with our patients. Most outpatient appointments are currently allotted 15 minutes for a return visit and 30 minutes for a new patient. Many departments are proposing a modest increase to 20 and 40 minutes respectively. We also seek to expand the number of providers to effectively distribute the workload rather than stretch us thin. For midwives specifically, our proposal would ensure that we retain our backup midwife on call for busy shifts so that we can give our time and attention to fewer people in labor at once.
A lot of the patients we do end up getting really close with. We will have patients stay with us for months at a time. So we learn about them, we get to see their families come in, we learn about their babies' names, we joke about their babies while they're growing still, and kind of just how we're trying to get them to their goal of delivery. We are proposing evidence-based guidelines based on A1, which for antepartum patients is a 1-to-3 patient ratio. So 1 nurse to 3 patients would be amazing. That would be allowing us to have so much more time to go in and assess and just speak with our patients. So for our lost patients, we try to spend the most time we can with them and be like, what all can we do for you? What memories can we make in this difficult time that will last forever? They find it very special, and it's very meaningful to the nurses as well to be able to be a part of that moment in making these lasting memories. And if we have heavy assignments, we might not always have the time for that, which is hard.
I have been in countless situations in which I am seeing a family and I only have a short period of time to address numerous problems and concerns. These families are worried that their baby isn't getting enough milk. These families are worried that they won't know what to do if their baby isn't feeding when they get home. Most families want to exclusively breastfeed, but when they don't have the education and support of a lactation consultant, they are not able to achieve their breastfeeding goals. There are very clear, evidence-based staffing standards that recommend for the number of births we do, we should have an additional 9 lactation consultants at UPMC Magee. With appropriate staffing, we aim to see every breastfeeding family every day that they are at Magee, improving the level of lactation support for the families of Allegheny County.
The reason why I got into the operating room is to take care of patients in their most vulnerable moments. That means when patients are asleep on the table, you are giving your full self. You are trusting us to help take care of you.
We did like over 16,000 procedures in 2025. That is with only 14 ORs, 2 procedure rooms, and 1 cysto room. And then only 20 PACU bays, and then only 8 discharge phase 2 bays. So we get very backed up very easily, as one would imagine.
Typically we range from I'd say
60.
low 40s is not normal, but typically 60 to 80 cases a day.
What we're proposing for staffing is we're not typically like our sister units where we have ratios. We have 1 patient at one time. We can only run 1 OR room at one time. However, just because we have 1 patient at one time does not make our job any less than those. I specialize in gynae oncology, so I take care of oncology patients. Some of those procedures go on over 10 hours to save somebody's life, and sometimes there's no staff to relieve us in those situations.
And we don't get asked. It's just, just this how it goes. So we're just asking to be compensated in that time of getting paid time and a half when we're staying past our shifts, regardless if we've been there for 40 hours or not that week.
We are required to take call pay on the weekends. So we pick, in a 6-week scheduling period, we pick 2 12-hour call shifts. It's supposed to be for emergencies only. Oftentimes though, you're pretty much guaranteed to be there. So part of our proposal is hiring 2 positions for a weekender program, just to help alleviate the stress of having that call and pretty much being guaranteed to be in there on top of I work a 40-hour week and then I'm on call 12-hour on the weekends. So it just kind of allows us to have a little bit better of work-life balance, and then I think we are then better employees. Adding that staff would actually increase OR block times and allow additional time for people to come in and get their procedures done instead of, again, stretching the nurses that we currently have thin.
Unlike basically every other ER in the system, our department census has gone up, not down since the pandemic, and 75% of our patients are women. We're seeing more patients than ever before, and they're often far sicker and with more complex social needs. We want our ER to be a place where your nurse has enough time to treat you as a full human in all the ways you deserve, whether you came in for an x-ray on a sprained ankle, forensic evidence collection after a sexual assault, or life-saving care after a miscarriage. Safe staffing is how we get there. A minimum of 1 nurse to every 4 patients, every shift, every day.
So when I found out that UPMC profited $625 million, it was shocking to me because there's always a statement of it's not in the budget.
Some of that money, for sure, can be put toward hiring more nurses.
We're not asking for massive change. We're actually just asking for the same guidelines that are there just to be implemented.
When I think about the future, I imagine a hospital where every nurse has the time that they need with their patients. A hospital where families feel supported and heard, and where the nurses can fully focus on the care that brought us into the profession in the first place. That is the vision that we are working towards here, and with the right staffing standards in place, I believe that it is possible.